Good morning to everyone who makes this broadcast possible, to Lázaro, to the sign language interpreter, and the audience tuned in to this briefing. We start today's press conference with the unfortunate news of the death of two patients. We extend our condolences to the family and friends. One is a 48-year-old female patient from Havana who suffered from some comorbidities. She showed the first symptoms on the 3rd and was admitted to the hospital. The patient remained 3 days hospitalized and 1 in the ICU. She had a rapid evolution, and unfortunately yesterday she went into a cardiac respiratory arrest. Despite the efforts made by our health professionals and specialists, it was not possible to revive her. Again, we offer our condolences to her family and friends. The other person is an 88-year-old woman from Majagua municipality in Ciego de Ávila province. She suffered from hypertension and was hospitalized for 9 days, 6 of which were in the ICU. She was admitted in the first place for being a confirmed case contact and presented some manifestations after being in the isolation units. Yesterday as well, she developed some complications from which was impossible to resuscitate her. I reiterate our condolences to her relatives and friends. However, I stress the efforts and actions undertaken by our specialists and the diverse treatment modalities implemented by the Cuban science. That said, as of today, we report 1,380 hospitalized patients, 57 under medical supervision, 753 are suspected cases, and 571 are confirmed active cases, a figure that proves to be high, however, presents a downward trend. Yesterday, over 7,000 samples were processed, 7,572. We have been working to cover a larger amount of tested people. In the next few days, some population studies will be carried out in Havana province, not necessarily in areas linked to transmission focuses, but in places whose characteristics respond to certain epidemiological parameters, in order to detect infected people that may be asymptomatic, since in most of the cases this risk group can be detected only through screening and PCR tests. Our main goal is to increase the amount of processed samples. Thus, yesterday we reached 7,572 samples in the molecular biology laboratories of our country, 2,328 at the Tropical Medicine Institute Pedro Coury, 982 in Havana's Hygiene, Epidemiology and Microbiology Center, 831 in Villa Claras, 290 in Santiago de Cubas, 778 in Hermanos Amejeiras Hospital, 658 in the Genetic Engineering and Biotechnology Lab, 466 in the Naval Hospital, 363 in the Manuel Fajardo's Hospital, 322 in the Center for Molecular Immunology, 310 in Fructuoso Rodriguez Hospital, and 229 in the National Civil Defense Center. As a result of the analysis and processing of these samples, 25 people tested positive for COVID-19, for a total of 446,776 analyzed samples in our country, of which 4,377 people, or 0.98%, have been diagnosed with the disease. Samples from all of the country's provinces were tested depending on its epidemiological complexity. Havana, the most, with 6,246, Ciego de Ávila, 562, Matanzas, 196, Pinar del Río, 94, and so forth from every Cuban territory. The 25 positive cases are Cubans, 22 are confirmed case contacts, for a cumulative of 3,911 people in this group. We could say that most of them have been in isolation units already, as indicates the proceedings when a case is confirmed and all the contacts should be tracked down and properly treated. The source of infection linked to 2 patients is yet to be determined for a cumulative of 39, since many people have been constantly recovering from the COVID-19. Of the 25 cases, 1 contracted the disease abroad. That patient arrived to Cuba and was diagnosed while being in isolation. Hence, it accounts for 24 autochthonous cases and 1 imported case, for a total of 427 people, or 9.7%, that have been imported cases. 10 patients are male and 15 are female, which maintains a balance of 50.1% and 49.9% respectively. There are not significant differences in this regard. 13 patients, that is 52% of all cases confirmed yesterday, were asymptomatic, which accounts for the 58.5% of all confirmed cases in Cuba up to date. As you may see, this is a specific feature of the disease that makes difficult its control. By age groups, 6 individuals are under the age of 20, of which 5 are in pediatric ages or under the age of 18, for a total of 472 patients in this age group. They've all presented a favorable evolution. However, there's a high risk in this population group. 395 of them, or the 83.7%, are recovered and discharged from hospital. 2 patients are between 20 and 39 years of age, 13 patients between 40 and 59 years of age, and 4 patients exceed 60 years of age. Of the 25 diagnosed cases, 12 belong to Havana, 7 to Ciego de Ávila, 4 to Matanzas, and 1 each to Artemisa and Mayabeque. As I mentioned, the imported case is from Havana province and belongs to Cerro municipality. Of the 24 local transmission cases, 7 are from Ciego de Ávila, of which 3 belong to Majagua, 2 to Ciego de Ávila, and 1 each to Venezuela and Moron. Leonardo will help us show a map that presents Ciego de Ávila's epidemiological situation, where there are 3 events of transmission, being the most significant event located in Ciego de Ávila municipality, which affects 7 local people's council and accounts for 31 infections. In the left side, we can see the great spread of the virus in the city. However, in Majagua, 7 cases have been diagnosed already, and so forth in other municipalities such as Chambas, Florencia, Moron, and Ciro Redondo, 1 case each, as well as the municipality of Venezuela that has reported some other cases. Matanzas reports 4 cases, 2 from Perico and 2 from Matanzas. Artemisa diagnosed 1 case from Candelaria municipality, and Mayabeque 1 case from San José de las Lajas. In Havana province, the 12 cases belong 6 to Diez de Octubre, 2 are from Boyeros, 1 case each from Habana del Este, Arroyo Naranjo, and Habana Vieja. These are the 12 autochthonous cases. Therefore, Havana's confirmed rate per 100,000 inhabitants is the highest in the country, although lower than the previous day, with 19.11, Artemisa's 14.37, Matanzas with 6.11, both of them higher than the previous day. Pinar del Rio 1.54, slightly lower than the previous rate. Ciego de Ávila's increases to 13.04, Las Tunas and Villa Clara with 0.93 and 0.51 respectively, same as the day before. Mayabeque increases its rate to 0.52 and Camagüey decreases to 0.13. Thus, Cuba's rate per 100,000 inhabitants is 5.39, slightly lower than the previous day. With this analysis, of the 4,377 diagnosed patients in Cuba, 571 are confirmed and hospitalized active cases, that is 13%, of which 561, or 98.2%, present a clinically stable evolution. At the beginning of the briefing, we reported 2 deaths, what brings the COVID-19 death toll in Cuba to 104. This means that the island has a mortality rate of 2.37%, lower than the global rate of 3.27% and the regional rate of 3.47%. We always mention the two evacuated patients at the start of the pandemic. Yesterday, 58 patients were discharged from hospital, what represents a positive indicator. 47 are from Havana, 5 from Pinar del Rio, 4 from Matanzas, and 1 each from Las Tunas and Santiago de Cuba. Thus, we accumulate 3,700 people, or the 84.7% of all diagnosed cases in Cuba recovered from the disease. 2 patients are in a critical state and 8 in serious condition. Inasmuch, 2 patients joined the group of those reported as serious. 1 patient developed some complications and passed to critical, and 3 patients reported as serious showed a favorable evolution and are now being closely monitored by our specialists. This is the behavior of the pandemic in Cuba as of yesterday. Concerning worldwide statistics, the world still faces a complex situation. COVID-19 pandemic remains to be present in 185 countries. 229,686 people were diagnosed with the disease only yesterday, for a total amount of 27,150,797 infections. Still more alarming is the 7,425 deaths reported only yesterday, one of the highest figures of deaths reported thus far, which accounts for 889,256 fatalities and a mortality rate of 3.27%. Following will show a map of the international situation. The darkest areas represent the most affected countries, which are the United States of America, Brazil, Russia, and India. The United States reports 6,276,421 infections. India occupies the second position already with 4,204,613. Brazil follows with 4,137,521, and Russia with 1,025,505. The United States yesterday's death toll is 403, India's 1,016, Brazil's 447, and Russia reports 61 deaths. In this order follows Peru, Colombia, Mexico, Argentina, and Chile. That said, the region of the Americas reports 14,231,407 infections, which represents the 52.41% of worldwide cases, and 81,010 people were diagnosed only yesterday. Of the more than 7,000 world fatalities, 5,423 occurred in our region, what brings the death toll to 494,693 and a mortality rate of 3.47%. The United States tops the list of the countries hardest hit by the pandemic, as can be seen in the regional map, followed by Brazil, Peru, Colombia, Mexico, Argentina, Chile, Canada, Bolivia, and Ecuador. Mexico presents a mortality rate of 10.66% and Ecuador 8.92%. As you can see at the bottom, Cuba occupies the 21st position in the region concerning the amount of confirmed cases. This is all the information on the behavior of the pandemic in Cuba and the world.